Good morning everyone. Today we are starting element 7 of NEBOSH IGC, which focuses on chemical and biological agents. In the previous element, we discussed musculoskeletal health and understood how poor manual handling and bad ergonomics can affect the human body. Now we move to another very important topic, which is chemical and biological hazards. These hazards are particularly dangerous because they are often invisible. You cannot always see them, you cannot always smell them, but they can silently affect body and may lead to serious health conditions, sometimes even life threatening. In these sessions, we will cover what chemical and biological hazards are, different forms of chemical agents, routes of entry into the human body, health effects of exposure, introductions to biological hazards. By the end of these sessions, you will clearly understand how to identify these hazards and how they impact workers in the workplace. So, let us begin. Let us start with the basics. What are the chemical agents? So, chemical agents are substances that can cause harm to human health. They can exist in different physical forms such as solid, liquid or gases. However, from a safety perspective, it is more important to understand how they appear in the workplace. These includes dust, fumes, vapors, mist, fibers. Each form behaves differently and presents different types of risks. That is why it is very important for safety professionals to identify the form of chemical present in the workplace. Now, let us understand each form in details. The first one is dust. So, dust consists of small solid particles suspended in the air. Examples include cement dust, silica dust, wood dust. This is the example of dust. When inhaled, dust can cause serious health issues such as respiratory problems, lung diseases, silicosis, which is an irreversible condition. This hazard is very common on construction site. The next is fumes. Fumes are very fine solid particles formed when metals are heated. Examples are welding fumes. Health effects include metal fume fever, lung damage. These are the health effects. Welding activities without proper ventilations or protective equipment can be extremely hazardous. The next is vapors. Vapors are gases formed from liquids. Examples include petrol vapors, solvent vapors. What are the health effects? So, dizziness, headaches, long-term organ damage. These are the health effects from the vapors. The risk increases significantly in confined or poorly ventilated areas. The next is mist. Mist are tiny liquid droplets suspended in the air. Examples are spray painting, pesticide spraying. These can enter the body through inhalations or skin contact and cause harmful effects. The next is fibers. Fibers are long, thin particles. A well-known example is asbestos. Health effects is lung cancer, asbestosis. This can be happen due to this. Due to its severe health risks, asbestos is strictly regulated in many industries. Now, let us move to one of the most important concepts, which is how do hazardous substances enter the human body. Understanding this helps us decide appropriate control measures. There are four main routes. The first one is inhalations, means breathing. This is the most common route. Hazardous substances enter the body through the lungs when contaminated air is inhaled. Examples are dust from cement, silica or wood, welding fumes, toxic gases such as carbon monoxide, vapors from paints and solvents. So, let us understand this by the real example. A worker cutting concrete without wearing a mask inhales silica dust. Over a time, this can lead to silicosis, a serious and permanent lung disease. Now, the second is absorptions, means through skin. Some chemicals can pass through the skin and enter the bloodstream. This usually happens when proper protective equipment is not used. Examples are acids and alkalis, solvents such as benzene, pesticide, oils and fuels. Let us understand by the real example. A mechanic handling use engine oil without gloves may develop dermatitis or skin irritations. Now, the third is ingestions, means swallowing. This route is mainly related to poor hygiene practices. Hazardous substance enter the body through the mouth. Examples are eating with contaminated hands, drinking contaminated water. So these are the examples. Let us understand this with a real example. A worker eats food without washing hands after handling chemicals, leading to accidental ingestions of harmful substances. Now the fourth one is injection through cuts or punches. This route is less common but very dangerous. Examples are needle stick injury, cuts from contaminated sharp tools, high pressure injection injuries. Now let us understand with the real example. A healthcare worker suffers a needle stick injury and is exposed to infected blood, increasing the risk of diseases such as hepatitis or HIV. Now let us understand the effects of chemical exposure. This can be divided into two types. The first one is short-term effects, which also called as acute effects. These occur immediately or within a short period. Example like irritations, headache, dizziness, burns. So these are the examples of short-term effects. Now the second one is long-term effect, which is also called as chronic effect. This develops over time, sometimes after years of exposure, like cancer, organ damage, lung diseases, skin disorders. An important point to remember is that not all effects are immediate. Some may appear only after prolonged exposure. Now let us understand the biological agents. Biological agents are living organisms that can cause disease. Examples include bacteria, viruses, fungi, parasites. So these are commonly found in workplaces such as healthcare, laboratories, agricultures and waste management. Now let us understand which workers are at risk. The first, it is important to understand that biological hazards do not affect everyone equally. Some groups of workers are at high risk. So these include healthcare workers, laboratory staff, waste handler, cleaning staff, agriculture workers. For example, healthcare workers such as doctors and nurses are in direct contact with patients every day. Because of this, they are at a higher risk of infections. Similarly, waste handlers who deal with medical or contaminated waste are exposed to harmful biological materials. Therefore, special precautions are necessary for these workers. Now let's talk about what are the control measures we can take for chemicals and biological hazards. In safety management, we follow a system called hierarchy of controls, and this is a step-by-step approach where we apply the most effective control first. The first one is elimination. This is the base control measures. It means completely removing the hazards. For example, stopping the use of harmful chemical or replacing a dangerous process with a safer one. If the hazard is removed, the risk is also eliminated. The second one is substitutions. This involves replacing a hazardous substance with less harmful one. For example, using water-based paint instead of solvent-based paint, using less toxic cleaning chemicals. So these are the examples for substitutions. This reduces the risk but does not remove it completely. The third one is engineering controls. These are physical changes made to reduce exposure. Examples include local exhaust ventilations to remove fumes, enclosed system for chemical processes, isolations of hazardous areas, proper chemical storage cabinets. So these are the examples of engineering controls. Engineering controls are very effective because they control the hazard at its source. So fourth one is administrative controls. These involve changing the way of work is performed. Examples include safer procedures, limiting exposure time, job rotations, training and awareness, proper labeling and signage, hygiene practices such as hand washing. So these are the examples of administrative controls. These controls depends on human behavior, so they are less reliable than engineering controls. And the fifth is personal protective equipment, which is PPE. This is the last line of defense. Examples include safety shoes, gloves, respirators, safety goggles, protective clothing. So these are the examples of PPE. PPE should only be used when other controls are not sufficient. Now let's talk about what are the health effects of biological hazards. What health effects can be happens through these biological hazards. So biological hazards can cause serious health problems. These include infections, allergies, toxic reactions. Examples of diseases include COVID-19, tuberculosis, hepatitis. So these are the examples of diseases. So these diseases can spread through direct contact, airborne transmissions or contaminated materials. Now let us understand what special controls can we take for the biological hazards. Biological hazards require additional precautions. Examples include vaccinations for workers, we can do this, proper disposal of biological waste using biohazard bins, sterilizations and disinfections, use of PPE such as masks and gloves, isolations of infected materials. These controls are especially important in healthcare environments. Now let us discuss an important document which is safety data sheet, we also called as SDS. And SDS provides detailed information about a chemical. It includes hazards, safe handling instructions, storage requirements, first aid measures, emergency procedures. Workers and safety officers must know how to read and use an SDS. It is very important tool for understanding chemical risks. Now let us look at safe storage and handling of chemicals. Proper storage is essential to prevent accidents. Important points include proper labeling of all chemicals, separations of incompatible substances, use of secure and sealed containers, well ventilated storage areas. Incorrect storage can lead to serious consequences such as fire, explosion, toxic exposure. Therefore, storage rules must always be followed. Let us look at a real life example. In a factory, workers were using a solvent. However, there was no proper ventilations and no masks were provided. After some time, workers started experiencing symptoms such as dizziness, breathing problems. And investigations happened there, and investigations revealed that there were no risk assessment had been carried out, no ventilation system was installed and no PPE was provided. Then after this investigation, the corrective actions were taken, and that was a ventilation system was installed, respirators were provided, workers were trained. As a result, health complaints were significantly reduced. So this clearly shows the importance of proper control measures. Now let us focus on exam preparations. You may be asked questions such as define a chemical hazard, explain the routes of entry into the body, describe control measures for chemical exposure, explain the purpose of a safety data sheet, give example of biological hazards. Now this is very important, you have to keep in mind, always write answers with explanations and examples. Only writing definitions will not give you full marks. Now this is the conclusion part of this video. So today we have completed element 7. This element focuses on chemical and biological hazards in the workplace. These hazards are often invisible, but they can cause serious harm. If you properly identify hazards, conduct risk assessment, follow the hierarchy of control, ensure safe handling and storage, then you can effectively manage these risks. Remember, workplace safety is not just about following rules, it is about understanding and applying them correctly. Thank you everyone. In the next element, we will continue with another important safety topic. Stay safe, stay aware.